Let's unveil the final product today, the Altaqi Kit. We have specially invited its inventor, Dr. Altaqi, to share his insights. Let's watch together.
Good evening, everyone. I am Zaher Altaqi, a root canal specialist. It is truly an honor to welcome you all to this special occasion, an event that marks a milestone in the world of endodontics. Tonight, we gather to unveil a breakthrough in endodontic microsurgery, a game-changing innovation designed to enhance precision, efficiency, and patient outcome. Endodontic microsurgery has always been a field that demands precision and quality. This procedure is considered as a main arm in our specialty, endodontics. In order to save natural teeth from extraction with high success rate over 90% according to the literature, it's always a challenge for endodontists to perform surgery because it needs many instruments, devices that are not related directly to our specialty, but may be related more to oral surgery field. So we as endodontists, we get confused. We need many instruments. We need an electric motor to perform the osteotomy. We need a straight or angled handpiece to perform the resection with difficult visibility and accessibility. We need ultrasonic machines and ultrasonic tips to perform the retroprep. So as an endodontist, I need to make my life easier. That's why I came up with an idea to design a kit of tips that could be used for the whole procedure steps with only one device, which is the Piezo unit. So one device and one kit for all the procedure, for all the steps, especially that we all know the advantages of the Piezo surgery over the traditional techniques, with less post-operative pain, less bleeding, more precision, and better quality of life for patients. Today, we introduce the tool that not only meets, but exceeds those expectations. This kit is a set to redefine how we approach endodontic microsurgery with a greater accuracy, minimal invasive, and optimal patient comfort. The kit consists of 8 tips, 4 tips to deal with the bone and the root, while the other 4 tips are designed for the retroprep. This is the first tip, which is the localizer tip, and the function of this tip is to do the osteotomy step during the apical surgery procedure. Maybe also we can use it to finalize the osteotomy over the thin bone or very near to delicate anatomical structure. So as you can see, with the localizer tip, I am localizing the root apex, I am shaving the buccal bone and doing the osteotomy in order to expose the root and then start the next step. This is the second tip, which is the bone cutter tip. This tip is specially designed for window technique to do the osteotomy and then remove the whole bone block and then replace it again. It's very efficient, it's very sharp to cut the lines of the window in order to perform the further steps. The third tip is the root cutter tip. The root cutter tip is specially designed for root resection, and also we can use it for osteotomy around the root. As you can see in the video, I am doing now the root resection perpendicular to the root, 90 degrees, with very efficiently and with great visibility. Now also I can use the tip on the sides of this apex or on the sides of the root to do more osteotomy with very, let's say, minimal invasive way. The fourth tip is the shaver tip. Shaver tip is used for smoothing the root surface after the root resection and smoothing the bone socket also after osteotomy. So this tip is very efficient because we can use it to remove any bevel after the root resection. And also, as I said, we can use it inside the bony socket in order to shave the bone and remove any granulation tissues there. The fifth tip, which is the shaper 3 millimeters. This tip is specially designed to do the retroprep in 3 millimeters in depth. That's why it's called shaper. So we need to shape the root canal, because in endodontic microsurgery we are doing a root canal treatment. So we need to shape the root canal and then we need to fill it. So shaper 3 millimeters is very efficient, diamond coated for 3 millimeters prep. The next tip is the shaper 6, which is a shaper tip with 6 millimeters for the retro prep. Usually we use it when we need more length. We need more length in depth inside the root canal, and we need to clean more in depth, so we use the longer tip. The seventh tip is the shaper L for retro prep in posterior left side area with difficult access, especially molars. The last tip is the shaper right for retro prep in posterior area, also with difficult access. As you can see in the video, the shank of the tip is long, and the bending of the tip is providing us accessibility to reach the mesial root easily of the upper molars in the right side. That's why we call it shaper right. So again, diamond coated 3 millimeters in depth for doing the retro prep in difficult areas like upper or lower molars. When the limitations of the instruments no longer constrain the surgeon expertise, and when complex cases are reduced to pure clinical mastery, this is the surgical revolution brought to you by Altaqi Kit. At the end, I would like to say that the future of piezo endosurgery for endodontists and endo lovers starts today. Thanks to Woodpecker and to all of you for being part of this landmark moment in the field of endodontics. My best friend.
Thanks Dr. Altaqi Zaher for sharing.